explain that, when, in what situation in spinal fusion is a surgery of choice in your hand?
Wow. Okay. So that's a great question. And it's a question that's evolving rapidly and deeply. When you think back on the time frame of what our opportunities to intervene on patients, traditionally it was wash out infections, do a laminectomy or cut away stuff to make more room for the nerves, and then hope that what was left was stable and strong. And that's where we got a lot of bad names for ourselves back in the 90s, 80s and 90s especially. And so the way I think about surgery today is it's not deconstructive, it's constructive. In other words, as the spine deteriorates, we can, the analogy that I think about is that's like your closet's getting full of stuff as you get older. You got 30 pairs of shoes and 12 pairs of pants that you haven't even seen in 20 years. And then the next year you got more of that. And the next year you've got more of that. And then all of a sudden when you walk into the closet, you don't have room and you're unhappy. Well, that's a nerve. Okay. It's unhappy. The traditional surgery was let's go into that closet and start throwing things in the garbage to make more room for more junk, right? Scar tissue, more aging, et cetera. The paradigm shift that happened with OLIF, as we're here to talk about, but also a couple of other techniques, was rather than going in there and throwing away clothes, why don't we push the walls of the closet further apart? Why don't we make a little more room in that closet?
That's a great analogy, Bill. That's a great analogy.
The second part of that is, if you're not a contractor and you don't know how to build walls, that sounds like a horrible surgery. Let's go in there and move things around. Oh my God, that's terrible. But the synergy between the new implants, the new imaging, the new navigation, it's actually now easier to move the walls than it is to throw stuff away.
Yeah.
In my opinion. Plus, I've got a more stable structure. And that's how I explain it to patients. I haven't come up with a better one than that, but I do think that's reasonably good. And so that's where
that's a great analogy. And to practically, I use a very similar analogy. I say I will restore the height of the disc to the point where you didn't have the symptoms by putting something between and lifting it up. And